Hi, you're watching Neuromoves on the couch. I'm Noah, a physiotherapist from Neuromoves Adelaide.
And I'm Jess, exercise physiologist from Neuromoves Canberra.
And today we're going to talk about the role of exercise in management for those with multiple sclerosis. So I think first, Jess, it's important to talk about the kind of some of the history of this condition and exercise, and how traditionally there's been a bit of mixed messaging around whether or not exercise is sort of safe or actually something good for those with multiple sclerosis. Found it interesting is that, like, in the sort of the dark old days, it was actually often something that people would get a multiple sclerosis diagnosis, and they would often get told don't exercise because that will make things worse. It's a condition where there's a lot of fatigue associated with it. And it was essentially said that no, don't exercise because it'll make it worse. Whereas now we know that that's really not the case, and generally is helpful, and often will certainly help with delaying a lot of secondary effects that people might get from their condition. How have you kind of gone about sort of working around some of that, and have you worked with any clients who've still got a bit of that idea around things?
Yeah, I think it's really important acknowledging that there's those things like heat tolerance, fatigue, some of those symptoms that do affect someone living with multiple sclerosis, but also the importance of exercise and movement and how that can actually help with those symptoms. And like you mentioned, really important at managing some of those other health side effects that occur from maybe moving less or being a bit more sedentary. So I think the two biggest things that affect the clients that I work with is that heat tolerance or lack thereof, but also fatigue is a really major one.
Yep.
When I'm working with clients, I think you're trying to provide them with that education that we can set up a safe exercise setting for them. So if we're talking about that heat tolerance, you know, we've got things like air conditioning, we can use pedestal fans when they're in an exercise session, we can make sure that the environment is set up appropriately for that individual. There's lots of technology around there as well, even just different materials, what you're wearing when you're exercising, utilising cooling towels, having cold water on hand. So lots of different strategies that we can use within an exercise session to make that environment more favourable. In addition to that, I guess, you know, managing that fatigue as well as that heat tolerance through different styles of training. So as an exercise physiologist, we love to obviously prescribe exercise, that's our bread and butter, but using training modes like high intensity interval training or interval training where we can actually exercise for a short period of time and then have that rest. And I think it's important to acknowledge that we can actually take a break, let our bodies recover, get our energy levels back, and then proceed with another exercise. And know that it's still going to be valuable that we are moving and engaging in those activities. And over time, I think you'll find that, certainly with the guys that I work with, they find that their exercise tolerance increases.
Absolutely.
And you can actually increase those intervals or do more exercise and have a greater tolerance for that. In addition, I think knowing the individual's body and how you react. I might be someone who exercises better in the morning compared to the afternoon or vice versa. So I think really working with those people and finding what environment's going to suit them best so they can engage in this sort of thing.
Absolutely. I think, like you said, given how important we sort of know exercise is or can be now for people with MS, reducing those barriers as best as we can and hopefully eliminating them just will make it so much more, give them so much more ease in terms of getting into the space. And like you said, often the things like heat tolerance and fatigue, if we can, like I said, through adapting our environment, which we certainly do a lot of as well at our clinic, then that'll just make it easier and easier for them to get into this space, given we know, particularly, like I said, those secondary effects are often can be the biggest part that is affected. But so for some of the secondary health impacts that can happen from just not moving around as much as might do otherwise. So things like heart disease and other risk factors like stroke, things like that. If we can reduce those by actually allowing people to exercise more, obviously we're trying to work on some of the more specific stuff to do with their condition, but just as a general and general health, reducing those barriers for exercise is massively important.
Yeah, and like you said, we've mentioned it in previous episodes where it's so important to get that family and community support. It's not just about exercising or going to a therapy session. It's about how that translates to your ability to participate in everyday activities, whether it's going to work, going down to the coffee shop with your family or friends, and being able to embrace the community and be outside no matter what the scenario might be.
Absolutely. And yeah, like I said, if we can give often some tips and strategies around sort of reducing those barriers obviously it's great in the clinic, but obviously they're not in the clinic for most of their week, most of their day. So if we can give them some strategies around, like I said, reducing those barriers in the wider community, that can also have a massive impact on just their day-to-day function and living. So one of the things that people sometimes often find coming into the clinic if they do have MS is that maybe exercise can make their symptoms worse initially, but over time people tend to adapt and their body will get more used to the exercises, and then in the longer run we tend to see an actual reduction in symptoms or improvement, or at least maintenance. And that's a big thing that can sometimes scare people off exercise with MS, is maybe they've done it in the past and they've just felt like it's knocked them out for the week and all of a sudden they just can't function. Whereas with some of those strategies that we've talked about already, we can often reduce that, but it is something that over time people generally do get used to, and then, like I said, we tend to see an improvement after that as well.
Yeah, it's a really good point. This is Neuromoves on the Couch. Thanks for watching. Find us on socials or on our website for more.